Good evening to all my friends who are out of station and are very much worried about the coronavirus situation. Uh, by seeing and by hearing, and at the same time, some of you might be witnessing the things that are happening in Delhi. Some of you might be witnessing the events that are taking place in Uttar Pradesh, in India. Some incidences are happening in Maharashtra, especially in Mumbai, where deaths are taking place in huge number, and the media sensation, mainstream media, where things gets narrated in a different way, and the shortage of oxygen, the rush of medicines like remdesivir, which WHO has not yet uh, mm, approved for the usage of remdesivir and have suggested and have advised not to use it for the COVID patients because of severe damages that are being caused, and adverse effects are also happening, which we are all are seeing and witnessing. And another factor to the cause of COVID chaos panics that are happening in India can be attributed to several factors which we are being hearing, witnessing, and several kinds of videos, messages, datas, updates are getting circulated in different social media groups, especially in WhatsApp. And we live in a tech world. All the information being disseminated um, are being disseminated across the world, and it cannot be hidden. And yes, as I go to my point, I would like to pay my homage and condolences and show my um, deepest uh, condolences to all the bereaved family who have lost their lives due to the fight of pandemic. And I also want to encourage our healthcare workers who are doing their job in different, who are doing their services in different ways to serve humanity. Yes, discrepancies and mismanagement, chaos, confusions are taking place, but these are all part of the struggle. These are all part of life. So it will keep on going on. And after all, the government has declared it pandemic. Whether the situation gets bigger and bigger, these things will continue on. And yeah, coming to the point, what I want to say is you don't have to panic. Yes, panic is there automatically. Lockdown is there, and shortage of medical supplies are also being heard and witnessed by several people, several of the victims' families in some of the states, which we are hearing and seeing it. And media coverage is also not taking place. And media reporting on adverse effects or medical negligence are also not been done. But this will continue on. It's not a big, it's a big deal and a big issue, but it will continue on. But leaving aside that, what we all have to do is, especially my friends who are outside of the state, you have to have a strong um, mental, mental, mental psychology, where you don't have to be too much into this media thing, where this will automatically uh, uh, dilute your mind. This will automatically affect your psychology. But what you have to do is, apart from several researches and several prayer requests that you're bending with people, I want to request every one of you. There are so many returnees, even in Nagaland, who have come back to Nagaland and have been staying in Nagaland with their parents, with their families, with their villages. But right now, what we have to do is, since the entire country is facing this problem, we educated people should connect with one another. And not only the churches, but especially the younger generations should try to connect with one another, being intellectuals, being educated people. What we have to do is, we have to create different kind of several meetings, Zoom meetings. I hope you will understand what I'm trying to say, because several things, say for example, say for example, um, see, because of lockdown measures, because of COVID guidelines and SOPs, um, gatherings in huge numbers are not permitted, or maybe even to have churches is not permitted, or maybe even to open up schools is not permitted. So what we have to do is, Since everyone is under confusion and medias are also only focusing more on this death rates, spike cases, they are not that much focusing more on the adverse reactions of vaccines, side effects of vaccines. They are not much focused on the medical negligence, several cases all across India. So, what we all have to do is we have to try to find out the solution by communicating with one another through platforms like Zoom meeting, which every one of us have got internet connections with every one of us. One day, most of you will be having 1.5 GB, some will be having 2 GB, some will be having 3 GB per day, and some will be having Wi-Fi internets. So instead of just wasting that internet, just be innovative, be smart, so that your smartness and your innovative and the information and the correct information that has been disseminated will at least make cautious of some people and make aware of some people, and the same meeting and at the same time um, disseminate the correct information that is being needed, because people are in chaos because the right informations are not reaching them because of so many media narratives, because of so many spike cases, because of so many burning issues. People are confused what to do, what not to do. I'm staying in Nagaland, and it's a beautiful state. Today, the date is 4th May 2021. 4th May 2021. And the environment is very cool in rural areas and villages. So, for example, in Nagaland, the population is very less compared to other states. In Delhi, where the population of 1 kilometer will cross more than 10, 15 lakhs, or maybe 20 lakhs, it may even exceed 20 lakhs in big cities, metropolitan cities. But in Nagaland, we hardly have around 1 kilometer. You'll find in rural villages 200 houses, 300 houses. Sometimes it is even 50, 60 houses. So people are not that much overpopulated. Even if there is a lockdown, we don't have much problems with issues with getting essential items, or maybe having fresh breath air, or maybe having good environment of natural air. Not necessary for us to even wear masks for the people of Nagaland who are staying in rural villages, because everybody has got their own company, everybody has got their own bakers. Uh, People meet, and even if the government enforces mask mandate, people are not that much even bothered about that, because that is the fact in the reality, whether we accept it or not. Yes, we respect the government order, but that is a fact in the reality which cannot be um, denied, which cannot be even said that it's not happening, because the reality is different. And the cases of COVID positive cases are also very low, in not only about Nagaland villages, but I'm talking about the entire tribals living in Chhattisgarh, tribals living in Northeast India like Assam, Sikkim, Mizoram, Arunachal, and these are Manipur. So these are the beautiful places, but in metropolitan cities people are having problems. On top of that, uh, big complexes, housing complexes, where uh, the entire building consists of around 200 families, 100 families, where the population in one building complex itself will come around 400, 500 people living in that building itself. So when people are made to stay confined in their own homes without being able to come out of their parks, automatically they lack sunlight, they don't get natural air, so they will be confined, they will go through many stress and psychological stress. On top of that, parents will have problem with their children, and so these are the issues, so many issues which are adding not only to the corona corona credit situation, but so many issues. Our health need immune system, strong immune system, but right now we are facing completely opposite. I think the marks mandate which the government of India has applied to all the citizens of this country, I think the government has got different experts, different intellectuals, different professionals. I think government should also reconsider on the issue of marks mandate, because I feel that marks mandate, yes, CDC, Fauci has already said that marks mandate is good, but even in America itself, America is divided between Democrats and Republicans. So states like Florida are coming up with orders where they have said that it's not necessary for the citizens to wear masks. So it's already passing out. They are passing out the orders, but our mainstream media, like in India, they are not telecasting all these things, and due to which uh, COVID is. I feel that COVID is not killing the people, but lack of proper awareness, lack of proper uh, dissemination of information is also one reason that is creating lots of panics, chaos, and people don't know what to do, what not to do. Just yesterday, I got a news in WhatsApp saying that um, Ramdeswir was caught in one of the state. Something like, I did not went through properly, but Ramdeswir was caught, something like that. Fake Ramdeswir protection. So these are the cases. Substandard supply of medicines has been taking place across the country for several decades. This is not the first case, but at least I'm happy. Those who ever have initiated for catching or maybe for confiscating or intelligence department or whoever be, they have done the wonderful job, because at times like this, even Supreme Court has passed out orders that hoarding of medicines, hoarding of oxygen supplies, they will be persecuted. So these are the steps where judiciary are also coming up with a positive sign. So I feel that judiciary are also doing their part. On top of that, law enforcers like police are also doing their part in controlling law and order problem, because situations like lockdown, situations like panic, job losses, or businesses losses, or maybe unemployment problems, when people go out of hunger, they will come out with different crimes and all this thing, but the crime rate is also very less, and I think the credit should go to the police department across the country, and they have done a wonderful job. But at the same time, what we have to look into it is health is an important integral part of our life cycle, where it is not only the government who are doing the best. Yes, shortcomings, challenges are there, criticisms are there at all corners, but government should not take it in the hard way, but take it in a positive way, because it concerns about the national interest, it concerns about the interest of all the states, and chief ministers of all the states should also be wise, not only to put their heads like this to our honorable prime minister during the course of discussion, during live Zoom meetings or webinar meetings, but they should also give critical analysis points. And every chief minister has got their own different cabinet ministers. Some of them has got finest of the finest, who have got the education from foreign countries, who have got the education in different expertise from medical department, from the science department, from the army department. So gradually people have got different expertise in different fields. So what they have to do is they have to suggest the chief minister, maybe different health ministers or health departments, to give the best suggestion, so that that best suggestion will reach to the national level policymakers. That includes ICAMR, that includes national health departments, so health and family welfare department. So another point what we have to see is, because see, nobody is benefiting in this thing, because one way or the other way, if there is a scam going on which people are accusing and alleging, things are going to come up. I'm drinking black tea. So what I mean to say is that scams will be taking place, because um, it is not only India, but it's a natural phenomenon where out of hunger for money, and all the businesses have closed down. On top of that, hospitals are also closed down. So gradually businesses will fall down. So what people will do is, the selfish people, evil-minded people will definitely come up with different kinds of scam policies, different kinds of evil ideas and policies, where they will be caught in one way or the other way, because people are also not this foolish. So what they do is that when they get caught, when they get caught, definitely the whole blame goes to the whole medical fraternity, this health fraternity, who are in the health professionals. So at times like this, even the health professionals are also in a frustrating stage. Not all health workers are bad. Health workers are giving the best of the best services, and we have high regards for them also. But in some cases, having so many cases where health cases are having so many negligency, and in some cases, in some states, I saw one of the video in Uttar Pradesh, where one of the spokesperson from the Samajwadi Party, one of the big political party in Uttar Pradesh, where the spokesperson was crying, saying that even paracetamol is not available in his own state in Uttar Pradesh. So these are the cases where government should also look into it, because see, one word way, it's about the government has declared, WHO has declared pandemic, so it is affecting everyone. So everybody should put their heads together, and since it is a pandemic, Parliament is also not having a session. Even state council of ministers in their own legislative assemblies and legislative council, some states have got two houses, some states have got one house. In Nagaland we have got one house, it is Nagaland Legislative Assembly. So some states have got upper house and lower house, but due to pandemic crisis or social distancing or all these things like contracting diseases from person to person, discussions are not taking place, debates are not taking place. So I would encourage all the council of ministers across India. What they can do is they can also have Zoom meetings, where the Zoom meetings can also be telecast, where people, their own people, can see what is taking place, what policies are being implemented. So this is one suggestion that I want, because until unless people see what that is being discussed, not only in newspapers, how will people, best of the best minds, give the good suggestions? Because if the situation keeps on continuing, there will be complete chaos, people will be confused, health workers will be frustrated, and there will be lots of pressure, not only from the government, but due to medical negligence, health pressures will also get excess pressures from the victims of the family. So these are the psychological stresses that will keep on evolving, and nobody is going to benefit. And see, India is a democratic country, one of the largest democracy in the world, and so we have got different political parties, and we have a multi-party system. Multi-party system. So what we suggest is that what we suggest what I suggest is that um, um, debates are not taking place, so they can have several Zoom meetings where all things can be discussed and should be critically analyzed, whether it is a positive side or it is a negative side. Because say, suppose example, in India we have got political parties like ruling parties right now in the center, that is BJP, Bharatiya Janata Party. On the other hand, we have got Congress, who is ruling in several states. BJP is ruling also in several states, and like TMC, which has got recently won the seats in West Bengal. We have got parties like AIDMK, DMK, or maybe we have got political parties even noticed like NNP, NPP, Nationalist People's Party, and we have got political parties, several regional parties in different states. Even in Nagaland, we have got two major regional parties, that is Naga People's Front and Nationalistic NDPP, Democratic People's Party. So nobody is benefiting when political leaders are chosen by the people to lead the people, and they are also anointed by God, and people believe that people from different religions consider them as their idol in one way or the other way. So the same way we look and seek our faith in God, the same way the public and the citizens have faith, have look up to their leaders at times like this. So I feel that I'm not saying that they are not doing the best, they are doing the best, but critical analysis is also needed, and that is what I think we have to we have to look into different aspects, and public should also change their mindset. Being all those narratives in the media saying that this much hike, that much hike, this much, that much, that this much spike. Yes, that will gradually happen. See, PCR testing has been made compulsory. Almost 80% of the health sector has been made compulsory, where people who needs to be admitted, or maybe people who needs to get treatment for several diseases, they have to get PCR test compulsory, especially in government run hospitals. So that will, what kind of, I mean, imaginary just thing. Suppose even if I get a sick, I would not wish to go. Suppose in my place, I would not wish to go to a hospital. So such things will go into the minds of several people, whether we like it or not, and whether you like to hear it or not. This is a fact and reality. So PCR testing, and PCR testing is also not providing genuine 100% result. So these are the things people are scared to even raise this issue, but this is the reality and this is the fact. Even doctors, medical fraternities, their own villagers, their own people, their own family members are becoming victimized of this PCR testing, which is not providing 100% genuine result. I'm also getting reports and videos where it is showing that some people have tried PCR testing in 2-3 locations and reports are getting different. I mean, these are the things. So I mean enough of politics has played, enough of blame has played. I think we have to, right now it is about saving the lives of the people. It is about like playing with the lives of the people. So whatever things has gone is gone, but right now at the present current situation, I think we all have to look to think about the solution instead of taking advantage of the situation. And for that, I would like to encourage all the intellectuals across India, all the college students across India, all the religious leaders across India, different religions, all the communities across India, all the civil society leaders across India, or maybe all the public leaders across India. Start debating. Even if you are not able to meet man to man or maybe person to person talk, just start using Zoom meeting. Just don't talk for the sake of having meetings with international committees. Just don't talk for the sake of having meetings to talk about all kinds of malnourishment, shortage of food and all this. But talk about how to find a solution. Talk about if the media is not doing their job, talk about that. If the government is not doing their job properly, talk about that. If there is a corruption going on in the medical fraternity, talk about that. We have to speak the truth, whether we like it or not. If there is a problem with the mask mandate, there is a problem with wearing of masks, talk about that. I'm not saying that you object it, but talk about that where solutions or maybe suggestions can be given to the government of India, given to the government of different states. And different states leaders have got different expertise in different fields. Some of the people has got best of the best brain in the religious. Some of the people have got best of the best friend in the students community. Some of the people have got best of the best friend in the business entrepreneurship community, in the sector. So these people can give best of the best. And see, we are talking about coronavirus, but economy of the country is also not good. Everyone is affected. Let's go around Dimapur and Nagaland. You ask anyone whether they are doing good in their businesses, whether they are doing good in their finances. All people will say that they are broke. Most of the people will say that they are bankrupt. Most of the people will say that they have lost their businesses. Most of the people will say that they went through bankruptcy. And most of the people will say that they cannot express the problems. So such is the situation going on across the country. 1.30 plus billion population is not a joke. 130 crore population is not a joke. So this is my concern, and we don't have to panic. And one more thing is, like, government also have to consider whether we are doing the right thing or not. Whatever guidelines that comes from WHO, I think government of India and Indians has got best of the best brains among the world. Indians have sent best of the best from in the IT sectors to the whole world. Indians have sent best of the best brains from the Ayurvedic, best of the best friends from the medical fraternity, who are serving even in one of the highest establishments in the United States of America, serving different presidents. So I think this is the right time where Indians can use their brain. This is the right time where all the experts can come together. This is the right time where we can also talk about not only mask mandate or sanitizers, but like disinfecting the whole area in the populated or overpopulated cities like Delhi, Karnataka, or maybe UP, in some parts of UP, or in some parts of Mumbai, where the population is very high, where the pollution level is very high. Not only I'm talking about pollution level in the sense like vehicle pollution, or maybe factories, industries, which are mostly located in these big cities. Or maybe smoke pollutions, dust pollutions. So these things are also already present in the air, which is contaminating the air. On top of that, we are disinfecting chemicals like sodium hydrochloride, sodium hydrochloride. Also, some places they are disinfecting. Though the disaster and though that is health ministry, they have given different guidelines for sanitizing or disinfection, but some, just to save money, they are disinfecting phenol. Some, just to save money, contractors or maybe the in charges, they are using Dettol, phenol, or maybe they are using something like DD powders and all these things. I don't know how for formula it came that these things will kill the virus. I feel very funny, but they are disinfecting the environment, and these are all poisonous substances. Even I do not wish to take something on the roadside. If it gets contaminated in the air, because air is polluted, it goes by the wind, and suppose if I wanted to have an varappa or samosa or maybe biryani or something like that in the roadside or maybe in the shops. If the area is contaminated, we should I would love to stay hungry instead of taking those things and make my body contaminated, because our immune system inside our body, our internal organs are so sensitive that we cannot inhale all these things. And people have got different um, complex diseases in their own body, where some will have asthma problems, some will have like something like allergic, something like people like me also have got allergic problem with dust allergic. So something like that. Even if I do not wish to take street food without washing my hand from the mineral water, if I go around the cities of Delhi, so just see the situation. And yes, on next video I will talk about unemployment issues. I will also talk about other issues, but this is the most important thing that which I wanted to talk. I think we should not panic and over that. um, Yes, medicines are also good. God has given brains and wisdom and knowledge to all the scientists and researchers to manufacture the medicines or to come up invent medicines. But right now, what we have to do is, if there is a shortage of medicines, always go for homemade remedies. There are different sites in YouTube's, different sites in Google's, different sites in independent sites where you can Google it out, or maybe through Zoom meetings you can encourage one another, or use WhatsApp to get the available resources. Don't just flip it for the sake of flipping or seeing the video, but use your brain. You have got the common sense, and when you hear, see, and listen and put it in your mind, don't just keep it for the sake for yourself, because it is affecting everyone. So just share the right information to the right people and to your community, so that chaos, confusions, problems will not arise up. And this is a situation where we all have to put our brains together by discussing, by debating, and also thinking in a critical way, where things can also be brought out into a solution. Because if we go in a situation like this, countries will go on like this, and I believe that lockdown is also not the solution, because after some states are imposing lockdown after 3 p.m. as if the so-called virus will come after, will not invade after 3 p.m. This is really funny. But yeah, I think we should start talking and we should start debating. Otherwise, if we keep on shutting our mouth, if we keep on silent stay, solution is not going to come. Everybody is facing the problem. Everybody will go into problem. Poor, rich, middle class, everybody is affected. And we cannot afford to see or wish to see more people dying just like birds, just like rats. And we cannot keep on blaming even the medical fraternity also. So everybody should start talking. Even the medical departments, medical officers, medical doctors should also start talking. Whether people accept it or not, just talk it. And we should start taking the good points, because we live in a democratic country now. We should start. If Americans are starting to talk, if UK people, Britishers are starting to talk, I think Indians should also start talking about the merits, demerits, and at the same time about what is good, what is bad. And if the goods are happening, if the good merits things are happening, and if people are diluting the environment, some systems are diluting the environment, we should also talk about it to find a solution. So, not with a heavy heart, but with a hope that good days will come. And the situation that right now we are facing, Indians are facing, and all across the country, all across the northeast, all across north, south, east, west, India is facing, one day things will get into very good. And on top of that, I pray that may all those who have lost their souls, may their soul rest in peace. And I believe, and I want to encourage all the family members who have lost their loved ones, be strong, and we will all remember one another in our prayer. And this is a time where all the religions should come together to pray for one another, to pray for healing for this country, to pray for healing for the world, and to also pray that God will open the minds to realize it, for the policymakers to come with the best policies instead of going around here and there with confusion mind. We also urge all the people to pray for the medical doctors and staff nurses, frontline workers who are doing their job, so that miscommunication or maybe misinformation, negligence will not take place, or misunderstandings will not take place between the families and those people. And I also pray that all the viruses, so-called viruses, that is happening, or maybe truth will prevail at the end. And I pray that truth will prevail. this is my message, and thank you so much for this is 30 minutes message. I am from Nagaland. My name is Akavi N Zhimomi. Today is 4th, 4th May 2021, and with concern I thought of not making this video, but something was really troubling me, so I made this video, but I forgot to mention. Please try to use Ayurvedic homemade remedies if you are not able to find medicines. Symptoms of flu, symptoms of coughing, these are all things which we have also faced in the past. Many of the people in Nagaland, even including me, we have faced the same situation last year. I think it was in May, June. Many of the people faced it, but we didn't went to treatment because of several reasons. Some went to treatment, but they got malaria typhoid positive. So what we did was that, despite of having medicines, several medicines, or staying confined at house, there was no healing. What we did was we took Loang, which we take it in Pan Masala में pan में खाता है वो Loang, loson, ginger, garlic, and that Haldi. English, what is that? Yeah, and little bit of salt, and we grind it like this for 1 minute, 2 minutes. Grind it in such a way that it becomes paste, and we put it in the hot water, boil it at a very high temperature, 100 degrees Celsius, and after make that into a soup, put it into that filter, keep the water, drink it warmly. 2 days. If you get the tasteless feeling, if you have the symptom feeling, drink it in the morning. At night you drink it, and if you can read it in the afternoon, you can drink it, and next day you follow it. 2 weeks, I guarantee your all these symptoms and all these things will go away. So this is a simple remedy as per my experience, as per many of the experience that we have tried, because we took several medicines but there was no cure. So these are the simple things, basic things which we have done, many of the people in the rural villages have done. And if you are finding hard to find all these things, contact all the people on your friend circle among rural villages. Tell them to parcel all these things. If it is not available in your society, tell them to parcel it by speed post or whatever it is to your area, so that at least some of your friends can at least send 1 kg or maybe 5 kg. At least your friends can sacrifice it, so that can be sent to your states, and you can eat it, and you can also help in preventing cough, sore throat, and all these things. And if you have got health complications, and if the doctors or maybe health experts doesn't advise you to take those things, I think you should prevent it. But if it is necessary, take it. And thank you so much for so sorry for taking so much time. Thank you so much. With regards from Nagaland, thank you so much. God bless you all.